Thank you. Nice to be here. So my name is Alasdair Cohen. I'm an assistant professor of environmental epidemiology at Virginia Tech. So we'll just jump right in. So drinking water sources, contaminants, health outcomes in Central Appalachia. So I guess briefly I'll say a lot of my previous work was and still is in LMIC settings. And for the last 5-ish years, I've been very focused on wash-related research in Central Appalachia. So first, what do we know about drinking water and health in Appalachia? Less than some of you might expect, I think would be the answer. So this is JMP data. And one of the things I just want to highlight here is, so this is for the US, and you'll see that we don't have good or any figures, estimates for the rural population as far as what percentage has access to safe drinking water. The best estimates, this is at least 2 million people. It was just on a panel earlier this morning. We were discussing with others and kind of agreed that this is almost certainly an underestimate. So as far as what do we know about health outcomes, so this is surveillance data for Ascaris. I'm just going to show this very briefly. This was a study done that found about 30% positive in Virginia. This data is from over 100 years ago. So Ascaris is, of course, not, it's primarily transmitted through contaminated soils, but just we don't have very good surveillance data for a lot of health outcomes of concern as far as water-related pathogens. And so part of what our group is trying to do is understand the underlying burden of disease associated with water-related pathogens. So very briefly, I just want to share, we did a systematic review meta-analysis study looking at all primary studies looking at drinking water and health outcomes in Appalachia. I'm going to go through this very, very quickly, but just so if you're interested, you're aware of it. We found 85 eligible studies, 27 that looked at health outcomes, but only about 4 that used cohort or case control designs, so mostly cross-sectional designs. And very few studies in the Central Appalachia region, which is where we're doing our research, and this is where Virginia Tech is, for those who might not be familiar. So I'm actually going to skip over this in the interest of time, but this is published, it's online. So we looked at chemical contaminants and heavy metals. Most of the work was done in the northern regions of Appalachia, a lot in Pennsylvania, a lot associated with fracking. There are also a lot of studies looking at PFAS, which you'll be hearing much more about in the next few talks. And then as far as microbials, E. coli and total coliforms, as you might expect, but again, very little data in the central region. And then as far as health outcomes, these were quite limited as well. There were studies that looked at acute gastrointestinal illness as the outcome, but the methods weren't really comparable as far as not lending themselves to a meta-analysis. But in any event, those are the results. The SI, we put all the data is up publicly available online. We just scratched the surface. In our SI, we note there's a lot of outcomes that we extracted the data but didn't report, or that the data is there and we didn't extract it. So our hope is that this is a resource for other researchers interested in that space. So coming back to the topic at hand, so we did an early study looking in collaboration with the utility in far southwest Virginia. They wanted to expand water to a cluster of households, utility water to a cluster of households on well water, and they were having trouble getting the funding. This is one of the issues we look at in these rural areas, the cost per connection to extend public water supply to rural households. And so we did a relatively quick study to characterize the well water quality and look at a number of other outcomes as well. And one of the things we found was we did find E. coli detection, and we found specific pathogens, Aeromonas, Campylobacter, or potential pathogens in Enterobacter in filtered well water samples. So the study I'm sharing with you today, so this is a prospective cohort study. Today I'm sharing the baseline results with you and a kind of teaser for some of the round 2, round 3, which we're working on now and hope to have out soon. But this is in far southwest Virginia in Wise and Lee counties. So these are on the border with Kentucky and Tennessee in the case of Lee County. And these are considered by the Appalachian Regional Commission to be economically distressed counties. So a lot of higher proportions of lower and low income rural households in these areas. And so the baseline data was collected in July 2022 in collaboration with East Tennessee State University, and one of my co-leads for this project is here, Dr. Rashedujman, pictured here when still a postdoc, just to give you a sense of the prep that goes into this. So this individual, we looked at individual level health outcomes. So we're going to households. So extensive survey data, including on reported health outcomes, individual level, as well as a lot of household level variables. And then for the water samples, so we collect multiple samples. So we'll collect one batch of samples, what we would call first draw, but it's not really, first thing in the morning first draw, it's when we get there first draw. And then we'll sterilize the taps, flush them for 5 minutes, and collect another batch of samples. If the households drink bottled water or spring water, which is actually quite common in these regions, we'll also collect a batch of samples from those as well. And then we look at physicochemical parameters on site, and then the rest we do back in our labs. We also collect saliva samples to look at historic infections with waterborne pathogens. And now in the studies we're currently conducting, we're doing the same, and we're also collecting stool samples from children's diapers. And I should note, after this, we mail the results back to the households to show them what's in their well water or their spring water. And if we see any results that are really high risk from a health point of view, then we'll call the households to let them know, as soon as we see it. So what did we find? So this is baseline. So the original design of the study, it's a prospective cohort design, and we were interested in following households, low-income households with utility water and those with well and spring water. We have a great partner for this, the Appalachian Service Project. There was a little bit of a hiccup in communication and design, so we ended up with more households on utility water than we expected. So we had 27 on utility water, 6 on well and spring, and a total of 83 individuals. And I'll just throw out as a footnote, we had a little trouble, so this is published recently as of a few months ago, and submitting it to journals, part of the feedback was, it's a relatively small sample size. And for like my other LMIC studies, where most of those are 400, 450, 900 households, this is a relatively small sample size. But we made the point, which I want to make here too, that for this context, this is actually one of the larger studies we have of its kind for Central Appalachia. There's just a real dearth of research in this space. And you can make up your own minds as far as whether there should or shouldn't be more research, but I'll show you what we found. So again, about 83 individuals in these 33 households. This is just a sense of some of the survey data we collected. So as you'd expect, some of the households with utility supplied water were also on septic systems, and of all the households on well and spring water were, and there were a couple of households with straight pipes. So this is the wastewater is not, oh really? Okay, 2 minutes. Time to healthcare, this is just a proxy for access to healthcare and other services. So here we're disaggregating the results by those with utility water and well or spring. So we didn't see any total coliforms or E. coli in the utility samples. This was from 9 different utilities. We did see, as you can see, we did see E. coli in 2/3 of the samples of those households on well and spring water. And in large part as a result of this, our current research, we're really just looking at households with well and spring water now. And we also saw Aeromonas, Campylobacter, and Enterobacter. So again, we're seeing the Aeromonas. In a pilot study we have now just looked at results with a collaborator. Again, we're seeing Aeromonas. As far as heavy metals, fortunately we didn't see heavy metals really of concern. The reason I'm showing you this is kind of ground truthing the way we think the world would work. So we see lower concentrations after that 5-minute flush, which is what we would expect to see. And one of the reasons we do that to be able to understand what contaminants we're seeing from the source water versus the plumbing. So just to summarize the results in one figure, so again, didn't really see issues with microbials. We saw some total coliforms, very few in the utility water, no E. coli. That was not the case for well water, and the spring water was the most contaminated. Just a quick plug, Dr. Rashedujman led a study looking at disinfection byproducts, so quick results from that. That's also recently published if you're interested. And as a sidebar, a lot of our work has looked at bottled water. And so this is something we've looked at in an LMIC context, and now we're starting to look at more in a US context. The idea being that distrust of tap water, whether it's utility supplied, well, or spring, a lot of households then use bottled water or other beverages, so that's something that we're quite interested in. And Dr. Shedusman led a study on bottled water too, which should be coming out soon. So just to wrap up, one of the things we did, we looked at all the households on utility water, and one of the things we ask is your primary drinking water source bottled water or utility water? So all of these households have utility supplied water, which we showed is safe as far as based on EPA, the Safe Drinking Water Act indicators. So think for a bit what you think these results would look like, and this is what we found. So subjective differences in people's perceptions, the groups they all have utility water, some drink bottled water, some don't. No differences that we saw as far as measured differences in water quality. Okay, so these really are the last 2 slides. Yeah, I'm eating into my QA time, I'm aware. So the saliva results, we were surprised. We saw a lot of crypto. So this is just baseline. We have subsequent rounds so we can track and see where people were on their infection curves. But we saw about 25% with cryptosporidium infections. And then for the reported 7-day diarrhea, I just want to highlight our first study we saw was about 11%. This study was 10%. And then the rounds that aren't published yet, round 2, round 3, it was 17%. And then another study we're doing now, which is only households on well and spring water, we're seeing 16%. So for those of you that have some sense, these are high numbers, even for an LMIC context. So this last slide, just some modeling work we did to look at what are the risks of detecting some of these waterborne pathogens in saliva. And we saw there's a positive, statistically significant association with an increased risk for those with septic systems and if they reported diarrhea. So we see an association between reported diarrhea and evidence of historic infections. It's been a long week. So with that, thank you, and I hopefully have a minute or 2 for questions.
I think we have time for 2 questions. Today is more packed for presentations in 1 hour, so who has questions?
Thank you. How did you enroll or find the households to enroll that are on wells? Because I think you mentioned you had a partner for the utilities, but just...
Yeah, thank you. Great question. So that's been, I'd say, also kind of contrasting the work I've done in LMICs and here. That's been really difficult, the recruitment side of it. And I think the short answer to the success is having good partners. In this case, it's a faith-based nonprofit that we're working with. So in this case, for us, the way it worked is when people apply to services from this nonprofit, they check a box if they're willing to have their information shared with other agencies. And so for any households that were willing, they were able to share their information. At that time on their intake surveys, they didn't have a question about water source. And that's how we ended up with more on utility. Now we're continuing to work with them. Their new intake surveys, they now have a question if you have utility or well water.
Another question? Yeah.
Thanks very much. Second great presentation from you today. I feel like you dropped the bombshell right at the end there in terms of the burden of disease, even compared to low and middle income countries. Can you talk a bit about the significance of that and how well known that might be within entities here in the States?
Yeah, thank you. And for if anyone else was on the panel earlier today where we discussed this, it's a big area where we don't have good data. And so I think the question I would ask, and very much to your question, is what's the burden of disease for households that don't have regulated drinking water, so households with private wells or spring water? And we don't have a good answer. So Dr. Heather Murphy, who's also here, just left a few minutes ago, she's done some really good work estimating that. That's something we're also trying to build on. But I think what we're finding here, at least for the people I've spoken to, it's higher than what we would expect. Now, we're also working to disentangle what of these infections are foodborne versus waterborne. So some of the pathogens we're looking at, we can be quite confident they're waterborne. Others can be just as well transmitted through contaminated food or other pathways. So we're still trying to tease that out. But I'd say short answer is, if somebody else has more information, I'd love to know about it. Okay.
Thank you, Alasdair. Thank you so much.
Thanks.
Next presenter, Kathleen Hohweiler.
Yes.
Yeah?
Yeah.
Okay.
Good job.
I'll try to pronounce correctly.
It's a tough one. You're fine. Yes, thank you so much. Yes, my name is Kathleen Hohweiler. I'm a graduate student at Virginia Tech. And today I'm going to be talking a little bit about our group's work on PFAS in Virginia private wells. So I'll spare you the long spiel about what PFAS are. I'm sure a lot of us are familiar, and I'm sure you're going to hear it from some more of our colleagues later this afternoon. But per and polyphenol alkyl substances, or PFAS, is a family of synthetic compounds which includes thousands of both known and unknown compounds. But there's really three things that we like to think about when we talk about PFAS. And one is that PFAS are bioaccumulative in human and animal tissue, meaning that the more you're exposed to PFAS, the half-life of longer chain PFAS can be up to 8 years in the human body. Two is that they're kind of known to be ubiquitous in consumer and industrial product, meaning that I could spend all day and all night talking about what products PFAS are in versus not in. And three is that they're persistent in the environment. Those carbon-fluorine bonds are extremely strong, making it really difficult for them to break down in the environment, and they ultimately do not degrade naturally. So because of this, and because of the sheer amount of PFAS, the situation with PFAS regulation on the federal level has been changing pretty significantly over the last 4 years. I started my master's degree in 2021 and submitted it in 2023, so the timeline of change in terms of that paper was rewritten about 3 times. And ultimately, right now, we have some final CIDWA MCLs, which means that those are enforceable for utilities across the United States. I'm so sorry. And those are in the single digits of parts per trillion, which is ridiculously small. So ultimately today I'm going to talk to you about private wells and private drinking water. So about 20% of Americans are reliant on private drinking water supplies, and these include these 3 main things, which are wells, springs, and cisterns. Ultimately, private wells are not subject to the U.S. Safe Drinking Water Act, meaning that the homeowner or the property owner is the person who is responsible for treatment, maintenance, and remediation of that system. Also, treatment, we know, is limited prior to consumption, and because of this, PFAS, or private drinking water supplies, may be uniquely vulnerable to PFAS contamination. So this is some data from the study that I'll be talking about today, where we can see that the most common treatments, if any are available, are for acidic contaminants, which include iron removal, water softeners, and sediment removals, and more than 60% of our participants have no treatment whatsoever. So there are some major questions as it pertains to drinking water systems and PFAS. One is that how does the use of something like solid phase extraction, which is a step in the process of analyzing PFAS samples using the EPA standard methods, how does that impact comparability between papers that use direct injection? And are PFAS detectable in private wells at the point of use, which is where people get their drinking water from in our private systems? So I'm going to talk about our study today, which we partnered with the Virginia Household Water Quality Program, which is through the Virginia Cooperative Extension, and they typically host drinking water clinics in about 90 counties in Virginia, and they offer affordable testing for 14 parameters. They provide interpretation and results and information about maintenance and how you can better address problems that you may be seeing at the tab. So we recruited 260 participants from these 7 Virginia counties. And please note that this will become interesting later, but all of the people that we recruited were past participants of Virginia Household Water Quality Program clinics, meaning that they had at least had their water tested once, and they collected PFAS samples as part of that suite of contaminant testing. So note that these are all repeat testers. So why are we comparing methodology in terms of analyzing PFAS at the point of use? One is that using different methodologies versus using this SPE step versus the DI means that it lowers comparability between papers. A lot of the most highly cited papers in terms of looking at PFAS at the point of use, including my own, uses either a mix of this DI and SPE, or just DI or just SPE. And we know that DI tends to result in higher reporting limits, so about 5 to 25 parts per trillion, which is above that 4 parts per trillion, and results in overall lower detection rates. The US EPA standard methods require the usages of SPE to lower these detection limits, but this can be really expensive and laborious in the lab. If you've done it, you know. So essentially what we did for this was we looked at collecting 2 samples per household in Montgomery and Rockbridge counties, which are 2 counties in Virginia, and we had 1 sample analyzed using the SPE step and 1 using DI. Essentially what we found was what we kind of already know regarding at DI is that direct injection really understates the total PFAS concentration in samples, meaning that a lot of the papers that we're reading and highly citing often are underestimating the true exposure to PFAS at the point of use, which we think is important, that we should be including that nuance in further work that we complete in PFAS. So when we talk about our water quality results from this study of the 260 wells in Virginia, 99.6% of the drinking water samples had at least 1 detectable PFAS. The average water sample had a lower sum value of PFAS with a maximum of over 70 parts per trillion, but the average was about 3.5. But the average household did have 7 detectable PFAS compounds at the point of use in each sample. So they're really small amounts, but it adds up in terms of what the true chronic exposure to low concentrations of PFAS might look like. And just to reiterate, so what's really important for us to talk about here is that 84% of these homes still had an MCLG violation of lead, which of course is 0 parts per billion, but meaning that even at the point of use now and in these repeat testing homes, they still have exposures to things that we know are negatively impacting their health, including things like lead. 36% of them had total coliform violations and 5 still had detectable E. coli, meaning that with this information that they've already received in the past, they still have these serious health concern pathogens and bacteria and for lead. So I like to call these the sickly systems. So 10 participating wells out of the 260 did violate that MCL for PFOA and or PFOS. So if we look at the 10 households here, we have each of these violates for one of those 2 things. But what was really fascinating to me and to my colleagues was that ultimately these homes had a myriad of other issues that are not just PFAS related. So we have a lot of total coliform positive homes. We have lead in 30 parts per billion. We have the study max for total sum PFAS. We have ones with serious system designs with the septic located above the wellhead, meaning that it's more likely to interact with the groundwater contamination at the point of use, later on. Some reported being sick from drinking the water. And ultimately, I just want to drive home the point that as important as PFAS is, PFAS is rarely the only problem that a single system is facing, especially in private systems. And I just don't want us to lose track of of all the issues that we might be facing in some of these homes. So ultimately, this was, it's important for us to talk about the nuance of methodology in terms of DI and SPE and just really think about how much we might be missing in terms of quantifying PFAS at the point of use. The sum total PFAS at participating households is relatively low, and ultimately a lot of them are still facing serious issues that are not just PFAS, but are lead and bacteria, which is concerning. And ultimately this brings me to how we are really struggling to fill the gap of knowing the complex low-level mixtures of PFAS and inorganics in private wells and how that really impacts human health. And ultimately, we can't be entirely certain what is contributing to PFAS at the private system point of use, as each one of them is truly unique. And I just wanted to thank some of our sponsors and some of my colleagues. And please let me know if you have any questions.
Questions? Yep. Okay.
Hi there. That's a great study. Thanks for sharing it.
Thank you.
Natalie Exum, Johns Hopkins School of Public Health. Hi. So I would love to hear about maybe your report back of results and how you're communicating risk back to your participants. Also, hearing that your water has lead in it is a super alarming thing. So are you communicating that, this is, anyway, it's just a big topic.
Absolutely.
I'd love to hear more about. Thanks.
No, you're totally right. And this is something that's critical to the work that we do. because we've collaborated with the Virginia Household Water Quality Program, they have like a template letter that we use, and so we fill in our information, including whether or not any of the homes violated an MCL or an SMCL or a treatment technique. And then they also meet with the director of that program, and she walks them through how they can better improve their system and their water quality. We also return letters for PFAS, and so they have that data for their own usage. My own piece is, I guess, that it's really hard to communicate risk, and this is something that like I struggle with, our group struggles with, is knowing how concerned people should be, and we try to rely on those US EPA guidelines, but yeah, we try to give that information back. It's hard, that's all I'm gonna say. Yeah, thank you.
Next question.
Hi, thank you. Really interesting study.
Thank you.
I was wondering, the results you showed for households are quite, they're variable, maybe not too much, but I just wondered if you studied any conditioning factors for the levels to be higher in certain homes and lower in others.
Oh, you caught me. I'm not done. I'm not done with my statistical analysis. We did, I think I've got some work, or maybe some stuff. Yeah, we had a bunch of different questionnaires that folks answered, and so some of them, what they answered was a bunch of survey data, including like locations close to or near known legacy sites of PFAS. So things like landfills in Virginia are all or most of them are unlined. Are they near animal farms or biosolid application areas? Where is your septic located? How old is it? When was the last time you had your septic pumped? And we're going to try to look at these statistically and see if there's any relationship between those. But I think, in my opinion, it really is variable in terms of like each home. And yeah, I'll be working on some bench scale studies to look at like PFAS leaching and whatnot. So we'll see. Yeah, that's where we're at with that. Thank you.
Next question.
Oh, you let me off the hook.
Yep.
Thanks.
Okay, so thank you.
Thank you.
Next presenter, Anna Boatman.
Good to go? Cool. Great. Thank you. I'm really excited to have this opportunity to talk to you a little bit about my Alligator project. I'm a graduate student in chemistry at UNC. So the key points that I'm hoping to share with you in the next 10-ish minutes, what are PFAS? Why should you care? What makes them so hard to measure? As a chemist, this is something I spend all of my time thinking about. And how can alligators help? So this is the fastest PFAS background I've ever given. They're everywhere, all sorts of consumer and industrial products, Teflon pans. They are found everywhere. So this is just showing where they've been detected in drinking water in the United States, but as I'm sure you're all aware, it's a really global problem. And they're probably not that good for you. So they've been associated with a lot of health outcomes, especially increased cholesterol levels and also decreased immune response. Okay, so one thing that makes PFAS challenging to measure is how do we get from exposure to health outcomes? Sampling water is about the easiest environmental matrix that we can test, but that also comes with some challenges. So there's a lot of day-to-day variability in water. Often PFAS are present at low parts per trillion concentrations, and PFAS can actually move around from water into sediment, which makes this just pretty hard to make sure that we can get a sample that actually has in it the thing that we're interested in detecting. And the second challenge is that there's many different types of PFAS. So this is a big class of chemicals that all meet this definition of this acronym. So as of this year, there are 6 PFAS that are regulated in drinking water in the United States. And how we measure PFAS, as Kathleen kind of talked about, so we use mass spectrometry, which is using the mass of the thing that you know you're looking for to try and see if you have that in your sample. So like PFAS is one of these 6 regulated PFAS. It has a mass of 499. So we target that 499 mass. If we see it in the sample, we can say that there's PFAS in the sample. And there's another couple of dozen PFAS that are commonly targeted using these mass spectrometry methods. And these PFAS that we know we're looking for, we can also quantify them, so we can measure what is the actual concentration of these chemicals in our sample. However, as Kathleen also mentioned, we know this isn't the whole story. There are over 14,000 known chemicals that are considered PFAS right now. 14,000 is too many compounds to target at once. Mass specs are really great, but they cannot do that. And there's even more unknowns that we don't even know what masses we should maybe be looking for to see if we can start finding these. So instead of darts, this is more like a fun game of really large battleship where we don't really know what's on the other side. So we need some more advanced techniques to help us really understand the full scope of the problem. And that's where high-resolution mass spectrometry comes into play. This is the instrument that I use every day in the lab. In my group, we have a fancy mass spec that also has liquid chromatography and another technique called ion mobility attached to it. And the advantage of this platform is it lets us detect just about any PFAS that is in our sample. We do not have to predefine a target list of compounds that we're looking for. And where alligators come into this, they are non-migratory. They live for a really long time, so over 60 years. And they live in water and sediment, so they're getting just a lot of exposure to these bioaccumulative compounds. So they can just accumulate more levels of these than you're likely to just find in a daily water grab sample. And alligators can also be used as sentinel species. So when I say sentinel species, I mean the classic canary in a coal mine, where if you can't measure the carbon monoxide, you could just bring canary, and if it falls over, then you know there's probably something going wrong. You don't need to measure the carbon monoxide to know that you have a problem. And our collaborators at NC State put out this paper. They did a study back in 2018 looking at PFAS levels in alligators, and they did actually find a correlation between PFAS levels in the alligator blood and autoimmune-like effects in these animals. So my study is just building on that. So we're looking at alligators in North Carolina. There are none native to Chapel Hill, but we do have them in the state more out towards the coast. So I'll just orient you to our study area. So this PFAS source shown here on the map, that's the Chemours facility. They're a fluorochemical manufacturer just near Fayetteville, North Carolina, right on the Cape Fear River. So for our study populations, we had some alligators from a contaminated site that's within the Cape Fear River Basin. And we also had a reference site. So this is Lake Waccamaw, if anyone's from here. It's outside of the Cape Fear River Basin, but still geographically close. So we did 5 years of gatoring for this study with our amazing team out of NC State, 2018 to 2020. In total, we ended up with 147 blood samples over that 5-year period. And we did a health biomarker analysis, which we're still working on that part, and I won't be able to speak about it today so much. But we did also analyze the plasma portion of the blood for PFAS. All right, so what we found, in total, we had 52 different PFAS that we detected in at least one of these alligator samples. And on average, at our reference site, there were 14 different PFAS per alligator, and our more contaminated site in the Cape Fear, average of 25 different types of PFAS per animal. So if we start to break this down a little bit, what are these 52 different PFAS? So 21 of them are on that list of the commonly monitored targeted PFAS, so we could quantify these, we could measure the actual concentration. And 5 of the 6 regulated PFAS are in these animals. The one we did not see was Genex. So then we also found 31 additional PFAS that we aren't able to quantify, but we know that they're there. And interestingly, so Site A, our reference site, is outside of the Cape Fear River Basin. Still, we had an average of 4 PFAS per animal that are not commonly targeted. And unsurprisingly, more PFAS at Site B. So we also have some data from the Cape Fear Public Utility Authority, which is just upstream of where most of these gators live. So this water utility actually targets 69 different PFAS in their water, which is quite good. That's a lot more PFAS than most methods target. But the 52 PFAS we found in the alligators included 13 that are not on this target list of 69. So what we've concluded from this, we are seeing some different PFAS in alligators compared to what we know is in the water, and unsurprisingly, more PFAS at our downstream site. All right, so looking at the quantifiable PFAS, so these are the 21 that we can actually get a concentration from. Again, unsurprisingly, much higher levels in the Site B animals. So an average of about 270 nanograms per mil in the alligator plasma. Nanograms per mil is parts per billion. And looking at what these 21 PFAS are, most of it is PFAS. So something interesting about this, PFAS was started being used in like the 1940s, but it's been phased out in the early 2000s, and yet that is most of the burden of PFAS in these animals. So half-life of PFAS in alligators isn't necessarily super well known, but we would expect to start seeing that go down since there should be no new PFAS since the early 2000s. Okay, so one other kind of interesting thing is there's a genetics exposure study done on people in Wilmington where they looked at the levels of PFAS in the serum from humans that live in Wilmington, which is, so they're neighbors with my Site B alligators. So I'm looking here just at the PFAS levels, so the majority of the burden of what was in the alligators. And we're seeing, unsurprisingly, higher levels of PFAS in the Site B alligators, about 10 times higher. And if we want to compare this to humans, so the Wilmington humans, their median levels are about 8.6 nanograms per mil. So even our reference site alligators had levels twice as high as what is in the close human population. And the downstream Cape Fear alligators had just much higher PFAS levels. And also just to note, the US national average is about half of what we see in Wilmington humans on average. Also, just to note, this human data, the most recent numbers we have are from 2018. Also, just throwing this out there, DHHS recommends additional testing if you have more than 20 nanograms per mil of PFAS in your blood. No one has told us yet what this should be for the alligators, but point being, it's probably not that good. So this is just reinforcing this concept that alligators are highly exposed Sentinel species. Okay, and so these human studies, just kind of nationwide, about the most recent data we have is from 2018. It's been encouraging that there's been a general downward decrease in human serum PFAS levels since 2000, but we don't really have more recent data than 2018, but I do for the gators. So what we're seeing here at our reference site, Site A, so this is showing the actual concentration of all 21 PFAS in the circles and solid line, and then PFAS only in the dotted line and triangles. So from 2018 to 2019, we do see a bit of a decrease. It was not statistically significant, but an encouraging trend, and same at Site B. But if we look at the next 3 years, unfortunately, we aren't really seeing that trend continue. It's kind of flattened out. None of these year differences were statistically significant, but it's just, I don't know, kind of interesting to note that it's not really decreasing. And these are only the PFAS that we can quantify. We know that there's 31 other PFAS in there too, and we just aren't able to put a number to what is happening with those molecules. So I hope I've shown you that PFAS are everywhere. There's still a lot we do not know. We need some advanced techniques if we want to cover more PFAS, and alligators can tell us more than water alone. So our next steps are continuing working through that health data to see if we can associate any trends with that. So huge thanks to my group, our collaborators in funding, and thank you all for your attention.
Questions? Yep.
Hi again. This is awesome. This is like a great study. I'm super excited about it. Can you comment on the long and short chain nature of the unidentified ones that you're seeing? And I would just love your thoughts on why you're not seeing a degradation down. I mean, you would think that the half-life, if we've phased out PFAS, would be going down. I just would love your thoughts on, you've thought about this for longer than I have.
They're really good questions. So for the PFAS, we can't really know. We can speculate, but our study wasn't really designed to look at sources. But I'm guessing it has something to do with we're it's very industrial. There's landfills, wastewater treatment plants, PFAS that has already been existing is just getting concentrated and put into that water. Also, it's possibly in the sediment. I think that's kind of a challenging matrix to characterize, how it's coming up of the groundwater and how they're really getting exposed to stuff that's already there. And it's the scarier part is there could be more novel compounds that actually break down into PFAS. So that is, potentially more area to look at. As far as the long and short chain of what we're seeing in the alligators, our platform, one downside of it is we're not very good at seeing the really, really short stuff. So none of the 52 are particularly small. And we're seeing a lot of like middle to larger molecules. Yeah.
Next question.
A little less scientific, but I think we're all dying to know, how did you get the samples, and do you have pictures and or videos?
I heard, how did you?
How and who?
I missed the second part of your question. I'm sorry.
Do you perhaps have pictures and or videos of the process?
Oh my gosh, Kylie, who's at Clemson now, she has some videos. I should have put one on here as a little bonus. I don't know if any of you are on Twitter, I think you can look up Kylie and she'll have some more fun video on there. But we fish for them, actually. It's rad and real, believe it or not. We do this all from shore. They replace the fishing line with like really strong something, like Dyneema, I think. You get a gator on a line. Your goal is to hook it under its armpit. And if you have a really big one, sometimes you need 2 or even 3 people to catch it on. You bring them in close to shore, put a little it's like a dog pole thing around its neck, and you bring it up, wrap its mouth in duct tape or electrical tape for the little ones. Yeah, alligators are very good at going, but they're not so good at opening their mouth. So just that, put a little towel over their eye, and you sit on them to calm them down. And then we do blood draws from the base of their neck. And yeah, it's not easy. Not easy at all. Yeah, thanks for the question.
When I take a shot, I always close my eye too, so I know what he means. Next question.
Thank you.
Thank you. Next presenter, Lily Rubino.
Okay. Hi, everyone. Thank you for sticking with us this afternoon. So my name is Lily Rubino. I am a PhD student in the Department of Geography at the University of Cambridge. So my current research explores the multidimensional impacts of PFAS contamination in the city of Newburgh, which is a small city in upstate New York. So for this presentation, I'm going to focus on 2 of my primary research findings. The first is that 6 years after the city water was switched to an uncontaminated source, levels of tap water distrust remain highest amongst residents of color, and persistent distrust is linked with a continued reliance on the commercial market to meet drinking water needs. So these findings emerge from analysis of both qualitative and quantitative data, including interviews, observations, a digital survey of residents, and archival research collected during my fieldwork in 2022 in the city of Newburgh. So the city of Newburgh, right here, is located about a 90-minute drive north of New York City and sits on the western bank of the Hudson River. Nearly 75% of the residents in the city of Newburgh identified as people of color in the 2020 census, and this includes more than 50% Latinx residents and around 25% Black residents. The city's poverty rate is well above the national average, although there is still substantial wealth in the city, with some residents owning multi-million-dollar homes on the banks of the Hudson River. However, the majority of residents still live in rental accommodation. So the contamination, the PFAS contamination occurred in May 2016, or rather I should say came to light in May 2016. So the city water department discovered high levels of PFAS, the suite of toxic chemicals we've been discussing, in the city's tap water, and a state of emergency was declared. The PFAS was a core component of AFFF, which is a firefighting foam that had been released from a nearby US military air base. And it was estimated that the foam had been running off into the city's drinking water undetected for over 30 years. So the day after the state of emergency was declared, the city was able to switch their water to a temporary backup source, and the following month they were able to negotiate long-term access to the Catskill Aqueduct, which is a rigorously monitored and highly protected water source that serves New York City. So a year and a half later, in around 2018, New York State had constructed a multi-million-dollar granular activated carbon filtration system at the water plant. So since the contamination came to light in 2016, City of Newburgh residents have received drinking water from a highly protected water source. This is sent through a state-of-the-art filtration system, and it undergoes daily testing to ensure that no PFAS have been detected in the tap water since. So my colleagues talked a little bit about what PFAS are, and so what I'll just say on this, they're colorless, odorless, they accumulate in your body, they're very difficult to break down, and evidence of the negative health outcomes have only continued to accrue as more scientists study the adverse health effects of PFAS exposure. So to turn back to the research findings, so before PFAS came to light in 2016, many city residents attested to drinking the water directly from their taps. Residents did not give much thought to whether their water was safe or not, demonstrating an implicit trust in their tap water. One city resident, Jerome, recalled, "Oh, we drank it by the gallon. We had these plastic jugs and would take water out of the faucet and refrigerate it for later on. We all used to drink it." However, after the contamination came to light in 2016, many residents told me that their trust in the tap water had changed as a result of the contamination coming to light. They stopped drinking it altogether and started buying bottled water. So this was confirmed in the digital survey, where 67% of respondents said that they stopped drinking their tap water when they found out about the contamination. So an initial decrease in trust in tap water after contamination revelations and subsequent exit to the commercial drinking water options like bottled water is common in communities that have experienced water contamination. So this is a logical response of consumers to any service where trust is built and confirmed by good experiences and reduced and broken by bad ones. But if you remember, the city switched to an uncontaminated source the day after contamination came to light. And this water, already of a high quality, is now run through this state-of-the-art filtration system. But what I found is that 6 years later, trust in city tap water had not been restored for all residents. So in the digital survey, there was roughly a 50-50 split between respondents who stated that they thought the current tap water in their homes was clean and safe to drink, and those that thought it wasn't. So when I asked Jerome, the resident who recalled drinking tap water by the gallon prior to contamination revelations, what he thought of the tap water now, he responded, "I wouldn't drink it if Jesus told me. I don't trust Newburgh's water supply." But if we look back at the results from the digital survey, half of respondents do believe that their tap water is clean and safe to drink, which does reflect some level of restored trust. So who are those trusting residents and who continues to distrust? So to find out, I disaggregated my data both from the digital survey and from interviews by several points of social difference, including race and class. And what I found is that the majority of residents who express trust in the current tap water were whiter, wealthier residents in the city. So Charlie, one of the white residents who had lived and worked in the city for a number of years, told me he trusted the current tap water and he drinks it straight from the tap. "It goes through the treatment plant now. I'm not afraid. New York City water, I'm sure it's fine." Conversely, the majority of residents who responded to the survey that they did not think the current tap water was clean and safe to drink were primarily less wealthy Black and Latinx residents. For example, Lawrence, a Black resident born and raised in the city, stated, "The water source I want does not exist. It would have to come from God himself. It would have to be God's hand watering, reaching out like this. That is the only one I would trust. If it is passed off to the city and handed back to us, I don't know, everything they've handed to us has been contaminated." Now, what I want to highlight from these two quotes is that both residents are expressing levels of trust or distrust in their tap water with reference to the water provider, the government. In the white resident statement, the fact that the water goes through the city filter means that it's safe and he trusts it, whereas the same process for the black resident deems it is unsafe and untrustworthy. If it passed off to the city, I don't know, everything they've handed us has been contaminated. So in interviews with both Black and Latinx residents, they expressed doubt about whether the city government would tell them if another contamination event occurred, and even admitted that they don't know if the government is making up the numbers when they release water testing results. In interviews with residents of color, I found that persistent distrust in the tap water is linked to a distrust of the government, who they see as failing to protect them from harm. Now, of course, the categories of Black and Latinx residents are not homogenous, and there is heterogeneity regarding levels of trust in the city water among residents of color, just like not all white residents express trust in the city tap water. But what I want to stress in this presentation is that if we do look at distrust and disaggregate based upon these points of social difference, we can see a pattern emerging that trust in the city's tap water has not been restored for many residents of color who are the majority of residents in the city. So this finding aligns with other studies on tap water distrust in communities of color like Flint, Michigan, where 2 studies undertaken 5 and 6 years after their water contamination crisis found similarly persistent levels of distrust. So the consequences of persistent distrust in Newburgh include a continued reliance on the commercial market to meet drinking water needs. Digital survey respondents who stated that they still do not drink their tap water routinely purchase bottled water from their local supermarket, or they fill up empty containers in one of 2 kiosks in the city. So one of those kiosks is located at the local branch of Culligan, which is a global business that specializes in at-home water treatment systems. And the superintendent of the City of Newburgh Water Department told me how Culligan used the water contamination to drive in business. As soon as this happened, Culligan put up a big sign, "Contaminated water? Come see us." If you go down there right now, there's a water dispenser on the wall, and folks line up to buy that water because they don't trust the water coming out of their tap. But what folks don't realize is that Culligan buys all their water from us. They put it in the tank and they put it through the dispenser, and people line up there. They're paying 25 cents a gallon when at home they pay less than a penny a gallon. So many City of Newburgh residents confess that buying drinking water from the commercial market was becoming more and more unaffordable as the cost of living increases. As the superintendent here mentions, municipal water in the city costs less than a penny a gallon, Culligan's 25 cents to a gallon, and a gallon of bottled water from a supermarket costs between $1 and $3 depending on the brand. Further, several families admitted that instead of water, they rely on cheaper alternatives like soda or other sugar-sweetened beverages, especially for their children. So the reliance on commercial water options due to municipal water quality problems is a trend that's reflected across the United States. The use of urban water kiosks has increased, and in 2022, the U.S. Beverage Marketing Corporation recorded 15.9 billion gallons of bottled water sold, reflecting a year-on-year increase. So this results in a vast amount of plastic waste. Someone mentioned microplastics as well in the water. So bottled water and kiosk water in the US are less regulated than tap water and often fail safety standards that public water systems like the City of Newburgh must adhere to, and these companies do not need to publicly report these failures. So to conclude, so this rebuilding tap water trust in the City of Newburgh is vitally important for the health and well-being of the community and the planet. However, institutional actors have historically tended to offer technocratic solutions to issues of water contamination, like the installation of a new filtration system, and leave it there. This study demonstrates that tap water trust is more complex, as these actions have not restored trust in and use of the tap water for all residents in the City of Newburgh. This is especially so for residents of color whose persistent distrust of tap water and use of commercial options is tied in with their relationship to the government. So as the EPA's new maximum contaminant level for PFAS comes into force, more communities in the United States will likely have to contend with the consequences of PFAS contamination and work to restore public trust both in the tap water and in the institutions that provide them. Thank you.
Thank you. Questions?
Yeah, I have a simple question, and that is, did you explore the influence of other, socioeconomic traits like, education of people? Like, because we know education, age, and all these confounders, they influence people's perception, whether, consume tap water or not.
Yeah, so I think what sort of motivates somebody to trust the water and what sort of motivates them to continue to distrust it is very complex. There are a lot of arguments around this kind of, knowledge base, around education. If they knew that it was safe, if they had more education, right? If they had more information about it. I didn't particularly study that, but I can say that anecdotally, what I did find, especially for going to disaggregate by race, is that for a lot of people, it was, they knew that the water went through the treatment plant. Some people had actually visited the water treatment plant. There was a high level of knowledge and understanding because the water department had done a lot of outreach, but what mattered more was that the government had failed to protect them, or they were immigrant families, so they were not used to trusting the water in their home countries, and so that compounded with the water contamination, and so they didn't trust the government in the US. So I think that it's a bit of a complex topic, and especially when you think about a solution, right? Like, we'll just keep releasing the water quality data and people will begin to trust again. So, but I think that community leaders, they really want to more focus on restoring the trust with the government to get people to use their tap water. Thank you.
Here first, but before I pass, can just comment. I'm Brazilian. I drink tap water because I'm a water guy. My wife doesn't. She only trusts bottled water.
So I just
Even if I tell her to drink tap water, it doesn't work.
just do a comment on that. Actually, we did have a big generational divide. So some people told me their grandparents do not trust the tap water. They said don't drink the tap water. But the younger generation who does not wish to use bottled water, doesn't believe in increasing plastic waste, didn't. But now with this water contamination coming to light, it's kind of changed their perspective. And the grandparents have like a bit of a told you so moment. Yeah.
It's a fascinating study, and this generational dimension of it is really important because it's during that some previous generation that the construction of trust occurred, and the archival record may not give you quite the socioeconomic dimensions of it, but the construction of trust has been far less studied than the construction of distrust. And so, and we heard on the first day one presentation by Mark Edwards who argued, it wasn't debated adequately, but that social scientists are actually amplifying distrust through a lot of their work. So the complexities that you mentioned are absolutely on target. One complexity, though, that you didn't develop was the one of religiosity, where the quotation from not only Jesus, but God set up a pretty high standard of what it's going to take to construct trust.
Yeah. Thank you. Yeah, and I think, straight.
No. Go ahead.
That this area of like implicit trust, right? Like you don't really, a lot of people told me they didn't think about whether the tap water was safe or not until they had to, right? Until the contamination came to light. And so how that implicit trust is built is interesting. And I think that especially for people who experience, exposure now, some of them, they'll never drink the tap water because of that moment of disjuncture. Yeah, thank you. Yes, hi.
Have you looked for any evidence of inflammation in the population in relationship to the level of sedimentation rate or any sign of inflammation?
Sign of inflammation?
Yes, inflammation in the body. The body has shows kinds of inflammation when there's an illness. So does the increase in the sedimentation rate Have you ever tried for that, looked for that?
So actually, I'm a human geographer, so I don't actually look at that aspect of the problem. But I will tell you that I did look at people's narratives of harm, which is a different way of producing knowledge around exposure. It's not epidemiological, but I think it's still valuable. And people themselves narrated how they felt the exposure impacted them. And a lot of people talked about like this general feeling of kind of like illness and inflammation in the body. Some people had these like they couldn't figure out why they had these autoimmune diseases. So I didn't study that particularly, but there are lots of narratives around different impact of exposure.
And just one other question.
Thank you.
Did boil the water make any difference?
Well-
Boiling.
Sorry?
Did boiling the water
No,
make
no,
any
not for
difference?
PFAS. And I think that's interesting because some people did tell me that it's okay because they boil the water.
But there's no effect.
It does not remove the PFAS. No, PFAS is very, very difficult to remove from the water. Yeah,
It's a
especially.
wonderful mystery.
Yeah, thank you.
We're out of time, but I think when I said there are two more people asking to ask questions, and I'm going to let them. I think it's the subject so interesting, and then, okay.
I'm just going to ask a very quick question because this is really interesting presentation. So I think we see more and more distrust in utilities, right? Like around the U.S. So one of the thing is you saw like when there was a PFAS contamination outbreak, like overall even happened. Public organization took the just the chance like started selling the utility water, right?
Yeah.
So what did the city do actually? What did they did to build the trust back? What did they first because
Yeah.
I mean I saw the interview. They said like they're buying the water from us and then selling it for 25 cents. I mean that's a nice comment, but then what they are doing? I mean it's been happening like a lot, right?
Yeah.
Now like the losing the trust, but what are they doing to gain the trust back?
Yeah, I think that's an interesting question. I think they're asking themselves that as well. But I would say there's this kind of idea around like face work, which is essentially like you build trust by getting out in the community and being like a kind of symbol of the water department. And you go and you talk to people and you bring city water to like festivals and events, and you have to do the face work to kind of get people to see you as that, the superintendent of the water as someone they like, someone they trust. They're at all of the events. They're working, with the big, like Newburgh Illuminated. It was one of the first cities that had electricity in the US. And so that kind of face work is really what they're focusing on. But because the community is largely Latina and Latino, and they have English as a second language, that's a barrier as well. And they're trying to figure out how they can kind of bring that community in and do face work with that community, which is particularly challenging. But I will say that that's like a local, sort of the local government has a role to play. But with these communities, especially the Black community, which experience urban renewal in this city, it's a big institutional distrust of the government there, right? Like the federal government, the state government, who has hurt them in the past, and that is connected to their current distrust of the water. And how you rebuild that, I think, takes like a larger reckoning within the United States and how our society is structured.
Last question, Natalie?
Thanks. I was just curious. You mentioned it with the blood PFAS levels were 4 times the national average.
Yes.
And it was brought to light in 2017. Was it brought to light because of the blood PFAS, or it was? Because the water was discovered first, and then everyone did the testing.
Okay. Yes. So basically, so the EPA. It was the EPA lowered their sort of like, it wasn't a maximum contaminant level, but they lowered their health advisory for PFAS from, I think it was like 100 something to 70. And so in that, New York State was part of this like pilot to test some water systems that served above like 10,000 people, and Newburgh was one of them. So it was actually the lowering of the level to 70 where they realized we have a problem, and the Department of Health and the DEC all came in From there, the Department of Health did the blood testing, but also just an important piece in that is that the majority of people who participated in that were the whiter, wealthier residents of Newburgh. They had a big problem recruiting people of color for lots of reasons, but one of which is like distrust of scientific studies because of the history that they have of being exploited. So thank you.
So with that, thank you so much, everyone. Let's have some fun, some wine, and safe travels.